Good morning. So I am Dawn Plummer. I'm the digital lead at the East Midlands Academic Health Science Network. So I wanted to come and talk to you a little bit today about who we are, how we support innovation, how we bridge between the needs of NHS organisations and our innovators, and also to talk about the current digital trends in the East Midlands. So firstly, who are we? So it's a really long-winded organisation name. People often hear the academic bit and think that we're really into the sort of research element, but from our point of view, we're almost the bit after that. So once something has been researched and it has been sort of proven to work, we want to test that out in the wild in our organisations. We want to prove that it works, and we want to then, if it works, implement that across the region and beyond. So we are one of 15. So as you can see there on the map, we can see all of our national, I couldn't think of the right word, all of our national counterparts. So we are commissioned by NHS England, so we are an NHS organisation, and we are so commissioned by NHSE and the Office for Life Sciences. And again, it's just, so our whole remit is to spread proven innovations within the EMHASN's locality. So for us, it's trialling things in East Midlands organisations and then working with the network to try and spread it further. So as a connected national network, we are uniquely able to import and export proven innovations. So we are really well connected with our network. So we share all of the innovations across the, if something's working somewhere else and it meets the need of our local organisations, it's really in our bag to be able to spread that. And we're in regular contact with our other EHSNs. So our mission is to spread healthcare innovation at pace and scale. So we want to improve the health of our region and beyond. We want to drive down costs through innovation and also stimulate economic growth within the East Midlands. So just to give you a flavour, and I won't read out all of this slide, but it just gives you an idea of the region that we're working in. So we've got the 5 counties of the East Midlands there. And as it says, we have around 150 partners across all the sectors in those regions. And so it's just to give you a flavour of just how diverse, and we believe that we are the most diverse region in the East Midlands in terms of culture and ethnicity of our population. We've got a 4.8 million population, obviously growing on, all the time. So it's how do we meet the needs of those people? How can we bring innovation into our local services to make people's lives better? And so what we do is we work really closely with our NHS and social care organisations. So we try to matchmake, essentially. We are an innovation matchmaking service, to put it in really, easy terms. So we want to match the needs and the problems to solve with innovations that we're aware of that can solve those particular problems. So we do what we call horizon scanning against challenge statements. Challenge statements are, what are your key problems to solve? In plain English, sort of what are your 3 pinch points in your organisation at the moment? We really try and drill that down to be specific. So rather than, I want to know all about mental health innovations, it might be, I want to know all applications that we could bring into schools to help children between 11 and 19 struggling with anxiety. We try and really pinpoint it to make sure that we can match to, innovations that are really going to meet those needs. And just depending on how wide we think that problem is, depends on how we go about it. So we can do horizon scanning, which is a desktop activity, and it just lists everything that falls into those brackets and, all the information around, which EHSNs are working with that particular innovator, what it is, how it works, the research that we have to prove that it works. And obviously then, if organisations come back and they show an interest in some of those innovations, we can then match them and set up a meeting with that innovator and that organisation to get the ball rolling. We also do innovation exchange events. So pre-COVID, we did a lot more of those in person. We tend to do them more virtually now, makes them a bit more accessible. So if it's something that we think is a problem wider than one particular organisation, so something that would be more across the patch, we run an event where we get lots of innovators to come and do 3-minute pitches in the room with stakeholders from NHS organisations that will be interested to hear those, and we give them time to meet up in person or in virtual rooms if we're doing it via Teams. So that's just the horizon scanning, but on a larger scale. We provide support for real world validation. So again, like I say, we're the bit after the research. We want to prove that it works out in the wild. So quite often we'll often to fund things on an innovation on a particular theme for, say, up to a year, so that it's almost that the organisation can trial it risk-free. We'll pay for the innovation for a year. We might help them with project support and evaluation support. So we'll pick key themes and we will then have an aim to do so many real-world validations within that area within a certain period. We also help with evaluation and adoption spread. So if we have a pilot running out as a real-world demonstrator in a trust, it really works, we will work with them to put implementation packs together, guides together, and to have those trusts then come and present their success to others within the area with a hope that we would then adopt and spread that further through our region. We help with evaluations, so we have an evaluation fund where organisations that are doing really innovative projects that perhaps we've had nothing to do with so far, and this really helped us after COVID to find out what was going on out there already, what's going on that's really innovative that everybody else should know about, but obviously this organisation is doing it in silo. So we set up a fund to evaluate basically deployments of innovations within trusts, again, to just get that kudos behind it, prove that it works, it's been independently evaluated, and it gives us the power to then go out and share that and speak to others about that success. We engage key stakeholders within our integrated care board. So again, we just want to find out what the priorities are, because quite often organisations are focusing on one or two really specific and particular things, and anything else that we share with them, no matter how great and how innovative it is, they don't have the headspace to be thinking about that. So it's trying to make sure that we're putting in front of them what's really going to tick their boxes. We don't always have the answer, but being part of the wider network gives us access to everything that our partner AHSNs are also working on. It says 800 plus innovations there. I think we're being a bit conservative. I was asked to look at what all of the projects that the AHSN network were working on to do with cancer, and we actually came back with 300 innovations, and that's just in that one particular area. So I think the pool that we actually have access to is bigger than 800, but we're probably, we're trying to be a bit conservative with that. So, sorry, I don't want to take up. I feel like I'm doing a lot of talking. So how do we support our innovators? So that's how we support our organisations. We have a really experienced teams. We've got people that are from the commercial sector. We've got lots of ex-clinicians. We've got people with a real wealth of experience within the NHS as well. So we feel like we're quite well placed to be able to give lots of different types of advice and guidance to our innovators. So we have a commercial team, so we can offer advice on value propositions, how we can identify our customer and our market, how we can sell our product essentially to the NHS. We can work on evaluation, like I say, so we can work with our innovators. Where have they already deployed? Where have they trialled this solution before? What data do they have? And we can sort of help them to refine that. So looking at things like benefits impact, cost impact calculators, and you can see there's a whole list of things. So we can look at how to refine that data to really pinpoint the things or the messages that we're trying to get across. We look at triaging and signposting based on needs. So depending on where the gaps are and what innovators come to us and say that, what they feel they need to work on, there are a number of programs, and I'll talk about those on the next slide, that we can signpost to, and a range of programs. So to assist the journey into the NHS. So it just depends what stage people are at, will depend how we triage them within our within the organisation. If we speak to somebody, we think they've got a brilliant idea and we think it really sounds like something that we would want to talk to our organisations about, we make sure we include that onto our database. So if somebody comes to us with a problem to solve in the horizon scanning, and it's making sure that we put that innovation out there when people come and talk to us if it meets their needs. We'd also invite innovators to our innovation exchange events. So once people are on our database, we obviously theme it around the innovation and what it's providing and the benefits it provides. And we then make sure that we invite people to the right events to do that matchmaking in future. So I mentioned that we signpost people onto programs. So we have a pre-Accelerator program that we run through We Are Pioneer Group, and that's all around the sort of basics around value proposition, commercialisation, customer mapping, and it also highlights funding opportunities. And that is open to all innovators through the We Are Pioneer Group website. It's also linked through our website, so at the end it's a much shorter link to write down, or obviously when we share the slides, there is a link on our website to apply as well. There's the Digital Health Accelerator, so that's delivered by our digital team in-house, and that supports SMEs with a digital focus. So we're looking at innovations that are digital to become NHS ready. So that's a year of masterclasses, workshops, one-to-one coaching sessions. And again, it's bespoke, so we try to tailor it around the needs of the innovator. So this year's theme is workforce. So we feel like that's a big problem to solve regionally and probably nationally as well, is how do we support and keep our workforce working? How do we help people to stay within the NHS? And so our key stakeholders within the region identify that as their problem to solve. So we've onboarded this year 4 innovators, and we've just onboarded them. So we'll be working with them now for the next year with the hope that in the next 12 months they'll be NHS ready and we'll be able to start talking to our organisations about these. We have got 2 of our last year's alumni in the room, so hopefully they would recommend us to others. And as I say there again, there's a big long link there, but you can get to it through our website if you are interested. And it's just to let you know that it opens at the end of every year. So unfortunately it's quite long until the next intake, and the theme changes every year as well. We also signposted the NIA, so the National Innovation Academy, and that's, National Innovation Accelerator. That's the, so it's basically EMHASN network supported. So again, it's another programme around trying to spread and adopt high impact innovations into the NHS. They are recruiting slightly earlier than our next intake, which is September 2023. And again, you can see the website on there as well. So just to talk around the kind of themes that we're finding at the moment, so the key digital themes, the problems people are coming with to solve, and the sort of themes of the key projects that people seem to be working on in our region at the moment. So as you will know, we've got a huge issue with having huge waiting lists and having lots of patients coming to the hospital that perhaps maybe don't need to do so. So one of our main themes is around keeping patients out of hospital where it's clinically safe to do so. Obviously, we want the right people coming through, and it's how we make sure that the people coming through the door are the correct patients. So we look at remote monitoring. So are there ways that patients can have wearables, or they can have some sort of device within the home to enable us to monitor them remotely and only bring them into hospital when absolutely necessary. And there's a whole load of devices available to do this. There are, obviously Fitbit, iPhone watch, Apple Watch, type devices. You could tell I'm an Android user and not an Apple user. And there's also devices, things like they can just tell if someone's got up in the morning and put the kettle on. They can tell if they flushed the toilet. They can tell if somebody's out of bed and doing something, or are they not following their usual routines. There's lots of ways that we can manage patients at home or people at home. We also have virtual wards, so a similar concept. So if you are within a certain specialty and they feel like rather than sitting in a hospital bed, you are actually safe enough to be at home with the right monitoring, they will again give the patients wearables and apps and tech to be able to monitor things like blood pressure, heart rate, and so on, and movement and everything else, so that they know when that patient may be declining, when to call them back. We also have, within our region, we're getting quite established with this, digital appointments. So not just seeing people via Zoom or Teams, but being able to see patients via or triage patients through digital, I'm trying to think of the right words, I'm sorry, but digital questionnaires. So basically, rather than having somebody come into hospital, they have to deal with driving around for an hour looking for a parking space. They have to deal with the stress of trying to find where they're going. So can we send them a questionnaire that will ask them all the same questions that a clinician would ask them, that would enable us to triage that patient and to determine whether or not they actually then need to be seen. So we started off doing that as follow-up appointments. So we've already seen the patient and then we onboard them. There are so many use cases now around pre-op, post-op, so making sure that people are recovering as we would expect from surgery without giving them the stress of coming back in. And we have rich messaging now. So we started off doing this via text only. We now have the ability in some of our hospitals within the region to send videos and send rich photos. So patients following surgery could show their range of movement, show their wound. And again, it means that you're not saying, well, they have to come in because I really need to get eyes on. It replaces that need to have the patient in front of you. We're also looking at diagnostic support via wearables. So there is a device that we are looking to trial within our region for sleep apnea. So rather than the patient having to come and sleep in hospital, and the waiting list is massive, and they sleep with all these wires, I don't know whether you've ever seen, they're all sort of strapped up. I would not be able to have a good night's sleep in that position. It's a small device that just sits here on the neck, and it can diagnose a patient in exactly the same way as all the wires, and it's been proven that it's as effective as the current alternative. And it's just keeping patients at home, so it gets posted to them, they wear it, they have an app that talks them through how to use it, and those results are sent to the clinician and they can review and see whether the patient needs to come in. So it's not just monitoring, we can diagnose people potentially at home as well. Another theme is prioritising patients waiting for treatment. So again, we've got a long waiting list to see patients or for patients to have a procedure. What are the solutions that we can look at to avoid deconditioning? And again, there's a range of different solutions, apps and different systems that we can offer to patients that allow them to sort of log how they're feeling, log certain stats about themselves, and it will almost prioritise the patient based on their need rather than this patient's waited the longest, therefore we will see them first. The next one down is really similar. So there are algorithms available and systems available from our innovators that will allow a clinician to say, so in a particular specialty, I really want to see patients that maybe their diabetes is quite poorly managed, the ones that have got high blood pressure, the ones that have got a high heart rate, rather than just seeing the patient that's waited the longest. They could then make sure that if they run urgent clinics, they get those patients in to those clinics rather than on a time basis. We've also got chatbots, so we've got a selection of innovators that offer chatbots that can help patients. Again, it's all things around health and well-being while they're waiting, making sure that patients are sort of doing what they're supposed to do while they're preparing for their surgery or for their appointments, and offering pathway support so that once they've been seen, in between appointments, it makes sure patients are doing what they're supposed to be doing, and it sort of could be reminders around, you know, what the clinician might have said to them, what advice they might have been given, to make sure that in between appointments, if they have to wait a while, they're sort of doing all the right things to make sure that they are ready for their treatment when it happens. We're looking at giving patients access to their records, so lots of people here may use the NHS app. We're trying to get that integrated so that all the different things that you might want to use are behind the NHS app, so that you're not having to remember logins to all these different systems, and it kind of switches people off. So some of those solutions that we were just talking about, a lot of those now are integrating with the NHS app to make it easier, and they've had massive uptake since they've started to do that because people don't have to remember different logins. And as you know, we can use that to request appointments, test results, booking immunisations like COVID jabs. I'm aware that I don't have much time left, so I'll speed through the next few. So we're looking at how to reduce the admin burden. So there are things that happen that people just do. Somebody sits every day and processes referrals and books them onto the system, let's say, books the patient an appointment. If it's a process that is very methodical, they can basically set up a robot, which sounds exciting, but obviously it's just a computer that can perform those tasks. Any repetitive task can be solved with RPA or can be done by a computer rather than a person, to free up the person to actually speak to other people or do something that only a person can do. We're looking at technology to support ongoing treatment. So I mentioned that already with the wearables to help people in between their appointments, to make sure they're on track, they're monitoring their health and well-being, and to reinforce messages between appointments to support adherence. We're also looking at supporting clinical decision making through AI. So AI can vet images for radiologists, it can check that the right people are in the right position on the waiting list, and it can check that people are being sent for the right tests based on their symptoms. That's lots of information in a really short space of time. So if anybody is interested to hear more about us, our company engagement form is the first step for us to work with innovators, which is linked there. It says there the form enables triage. So some people think, I'll keep all of my really interesting information for when I meet you. The more information that gets put onto the form, it enables us to triage you to the right team or to the right people to speak to. So if anybody is interested, please do contact us and we can start the conversation. And you can see there our website is again on screen for anybody interested.